Hi, welcome back. This is K19. Just bringing you guys along onto my panniculectomy journey. I am 4 days pre op. Today is August 1st, 2026, and I am 4 days pre op. My surgery is August 5th, 2026, and that will be next Wednesday. Okay, so let's get into a couple things. First thing is, how do you go about getting a panniculectomy surgery? What are qualifications? What do you need to do, or what has to be required and such? First, insurance, out-of-pocket cost, and so on. Great. I'm ready to get into all the things. First off, panniculectomy. That is surgery of the pannus. The pannus is the lower belly fat area, in which in the Western world that we live in, we'll call it a fupa. It is not a tummy tuck. It is not to be mistaken with a tummy tuck. A tummy tuck is complete muscle repair, full abdominoplasty. A panniculectomy is strictly lower belly fat and skin removal up to so many, a minimum of so many inches. When I went to my consult, my surgeon, she measured my pannus to be 3 centimeters. I'm not sure if that's normal, average, above, whatever, but I did see in documentation she measured at 3 centimeters. So she did send me all the paperwork after the consult. She did give me she gave me the cost that it would be out of pocket. She gave me, let me know about insurance because she was going to submit that over first. She gave me cost about a couple other areas that she thought I may be interested in. There is one other area I'm specifically interested in. It's just, it is so much for this particular surgery. I am not prepared to pay for it at this time because it is no way covered by insurance. So it would be strictly out of pocket. But she did give me the figures for that. And I said, hey, I'm only interested in the panniculectomy. That is what my insurance seems to cover. And I want to move forward with that if possible. And so her office, they did all the paperwork. Just a side note, I have insurance under my husband's employer. At the time of consult, up until July 1st, I had this particular insurance, which is it's Blue Cross Blue Shield. I had this insurance, and I had a HMO plan at the time of consult up until July 1st. Now, it is covered under that, but it did require prior authorization to be approved, and which I did receive authorization. It was approved. Cool, everything was a go. Then my husband changed jobs. We still have Blue Cross Blue Shield. It's just that now we have a out-of-state PPO plan. So going through that and to get everything, because when you change plans, insurances, you have to go and get pre-authorized and all of that jazz, so they can have it in system to make sure you're all good. So because it's short notice, I got all this done literally early this week. I got all that taken care of under the new insurance. Because as of July 1st, he had new insurance plan. Still Blue Cross Blue Shield, just a different plan. Which prior we had HMO in-state plan. Now we have PPO out-of-state plan. And with this new plan, literally early this week, I was able to settle everything with authorization. One, with this particular plan, no authorization is required for this particular procedure. Great. I was excited because my concern was I hope they get back to me in time to approve authorization because surgery is definitely around the corner. Now, the previous Blue Cross Blue Shield HMO plan, authorization was required for this particular procedure. So, I've worked in insurance before. I've worked in different spectrums of the insurance industry. What I will tell you, before you have anything done, especially things of major surgeries and things of that nature, whether it's in or outpatient, please verify with your insurance, 1, procedure is covered. 2, if authorization is required. 3, and that you have the authorization approved much before surgery. That way, you will not get hit with a bill after surgery stating that, oh, this was not covered, this was never authorized, here's your bill. So that's what I will say about that. So all I have to pay at this point is my deductible with this new insurance plan. Fine. My deductible is like $350 because it's a new plan and we just switched over to. So we have not met all the requirements, so that's why I had to pay the $350 deductible for this with this particular plan, and that's all I had to pay. My plastic surgeon, she has been wonderful, very nice, and I'm just hoping that she does a good job, and I am, she's just going to be most successful in her work on me. So, what else? Surgical center, because I'm not going to be at a hospital. I will be having this procedure done at the surgical center. Surgical center reached out to me, and one, I had to get blood work done, so I had to get a CBC, which is a complete blood comprehensive panel, and I had to get an EKG, which is where they check your heart and make sure all of that is good. And I also had to get a BMP, which is just a basic metabolic panel. And again, they're checking all of your blood work, checking everything to see if you're good, what your levels are. Thank God I work out literally every day. And I try to eat in moderation certain things. So everything came back normal. My levels is all green. I'm all good. So that's not a worry about there. I had the EKG done yesterday on the 31st. Everything was normal there. They sent that test over. So we're good to go. They will be giving me a call the day before to let me know the time of the exact time of the surgery. Right now, all I know is that it's on the 5th. I don't have the time just yet. And so surgery center reached out. They said there was a few things that surgery center said. She called, she said, okay, she asked me several questions. She said, are you on any supplements? Say yes. I take supplements every day. I work out every day. Every day, I take a probiotic pill daily. Every day, I take 2 detox body cleanse pills at night. Every day, I am taking a pre-workout in the morning before the gym. Every day, I am, well, maybe not every day, maybe every other day, I am drinking protein supplement, protein powder mixed with collagen and water. So I'm taking that about every other day. And she said, okay, no supplements, no NSAIDs, which is basically like pain pills and such. So she said, do not take those, do not take any supplements. the 4.5 hours before surgery, she wants me to drink about 2 to 4 bottles of Gatorade, preferably not the red kind, any other kind, but not the red, and take 1,000 milligrams of Tylenol 4.5 hours before surgery time. Okay, so do that. And she gave me a list to also wash the day of and the day before in something called hibicillin or something like that. I have not bought it yet. I'm going to go out and get some because they recommend it. And this is basically, I'm sure, is just to make sure I don't get any bacteria or anything like that, beforehand and during surgery. So this helps with that, even though in surgery they always go in and they use certain stuff to do so as well. But this just helps to make sure your skin is as most clean as possible, of course. What else? I think also said no perfumes, no deodorants, no lotions. Basically the typical. This is my very first surgery, so I've never had to go through any kind of surgery before, ever. I'm 40 years old. Ever. And this is elective for me. So I've chosen to put myself through this. I know some people may ask, but after losing over 100 pounds and the way I work out, there's about 4-5 days where I work out twice a day. Twice. Some people may work out every day, but just once. I work out every day, but out of the 7 days, 4 or 5 of them, I'm working out twice. Mornings are a must for me, and the evenings are optional, but I take classes usually in the evening, and I like them, so I go in the evening. Weekends, I'm a minimum. I'm taking 2 classes. So, and definitely I'm doing my own workout on Sunday. So there you have it. I'm working out multiple times. And and this is the crazy part is you don't take care of your body, especially while you're younger. When you get to this age and, you lose a hell of a lot of 100 pounds is a lot of weight. It's a lot of weight. And I didn't just lose this in 2026. I didn't lose this in 2025. I lost this starting pretty much end of 2022. And I noticed that 100 pounds was gone by the end of or somewhere early 2024. That's when all that weight was gone. So this wasn't an overnight thing for me. I got a trainer after I had lost 25 pounds, and I was like, oh, I'm getting stagnant. I don't know what else to do. I got to get more of my eating. And I got a trainer. And I don't care what nobody said. When you get you someone who knows what they're talking about, wants to help you, it's going to pay off. And not only that, you doing the work. See, I only seen my trainer only maybe once, couple times a week. So a lot of the work throughout the week was on me when she wasn't around, for certainly. So you definitely have to put in the work. It's not easy whatsoever. I'm not going to cap. None of that. It's not easy. It's still not easy to this day because I'm still trying to maintain, which is why I feel like I still give my body the movement that it does, because I want to maintain. And then as time went on, I found there are different things I want to do with my body. This season, I might be and I want to gain more muscle season. This season, I might want to see a different number on the scale, meaning I just concerned about losing the weight, maybe not so much burning the fat. But the most important thing is building the muscle and losing the fat regardless. And when you build the muscle, the number is not going to always reflect on what you think it should reflect. But you're definitely going to see a difference. You're going to look different. You're going to feel different. I take the InBody test, which is a test that they have that measures your body fat, skeletal muscle mass, soft lean tissue, and fat in different areas of your body, and your weight and the amount of water that your body is containing. I take that twice a week. Now, you don't need to take that twice a week. But that scale just gives me like the boost, the motivation, and the information that I need on the goal that I'm trying to get to in this season. So you may be in a season to where you just worried about the number. You just want to lose weight. Fine. You may be in a season to where, like, I want definition in my body now. So I'm not concerned on just losing weight. I want to lift. That's fine also. You're going to go through these different changes and these different emotions when you are just on your own fitness journey. It's going to be different for everyone. It's going to look different. So while going through this, I realized, hey, I don't like this extra pudge pouch. Now, I have 2 children. My last baby was in 2014. This is my last pregnancy. Okay. I have not been the greatest. Now, there's been times throughout my life, especially younger, where, I've been hit the gym and, I stayed focused. But after I had baby number 2 and I got wrapped up in life and things were going on and just complete laziness has took over, I was extremely overweight. When I look back in my records, I was over 270 pounds. 270 pounds. And when I look back throughout the years, I was that heavy in the 200s for a course of over 8-year span. 8 years. 8 years. And what that told me was like, wow, I've never been this big. I was on high blood pressure, diabetes. It was insane. And so now, after working out over the time, lost the weight, cool. That's going to happen as long as you stay consistent and disciplined. That's going to happen. But now when you look at your body, like I said, I'm 40 now. The body's going to change anyway. And after having 2 kids, how usually we don't do the things that we should for our abdomen, for those muscles to come back together as well. And collagen as well. I'm like, I don't like looking at this pudge here. I feel like I do so much work. I don't know 5 people that, and I'm talking about personally, know 5 people who work out. I don't even think I know 3 personally who work out at the extent that I work out. And even personally work out 7 days a week. So for me, and in my journey, I feel like this is something I owe to myself. I feel like I deserve this. I feel like I deserve to look my best. Now, is there another area that I also will like? For certain. I feel like that's going to come in due time. But let me take care of what I can take care of now. Again, I've done the work and I just want to look my best. It's a personal thing. I know everybody else look at me like, oh, you ain't really got nothing there. I understand. But something I said in my workout videos a while back, anybody can look good in their clothes. Well, I work out so I can look good with my clothes off. So there it is. I want to look the best possible with my clothes off. So, and I feel like this is going to do nothing but enhance and take me there, is getting rid of this amount of fat and skin that I have there. So that's my whole reason for this journey. I'm really hoping that this would resonate with some people. I know some people out there has had weight loss surgeries. That's not my story, but for those who had, I feel like this could resonate with them as well. I feel like this will resonate with people who on the same path that I am on. I hope that this resonate with someone who don't know where to begin. I hope this will resonate with someone who fall down but keep getting back up, because that happens too. So I just hope that this resonate, and I don't mean the surgery resonate with you. I mean the whole thing, the whole process, the whole journey, the whole discipline, consistency of it. I just hope that that resonates with someone. So they're like, yes, I get it, I understand, and I just hope for the best. So yeah, I just hope that this could resonate with even just one person. And I hope that this, is helpful and useful information in case anyone is considering, or they just have lack of information of such. And I'm a person, I do research. I went and researched the surgery, and also look for videos on YouTube. Honey, it was not a lot. And this is why I decided I'm going to vlog mine. And I hope I can give the most realist and most detailed content that I can of this journey, because someone who is looking to get this done or such, having the wherewithal or the know in this surgery is very helpful. And if you can see someone else go through it, or you might take a piece and be like, yeah, I heard everything she's saying before, but if I just said one thing, like, oh, I didn't know that, then that can be helpful to someone. Because I only went through 3 different videos that I found on YouTube, and I did get some information, and there was one person who had really good information, but a lot of it was just, you had people on there, doctors who were giving texts, but I'm looking for people who had actually been through the journey. So that's the purpose of me vlogging this. And hopefully someone can find some use for it if they need it. Okay, moving on. I gave you some history and some background. So moving on. Emotionally, I'm not there. I know I'm excited. I'm excited because this has been going on. I had consultation in April. I got a surgery date the week of my birthday in June. And I had to go flip-flop through insurance information in July. So, this has been going on for months. So I'm glad that it's finally here. It's arriving. I got everything taken care of and squared away as I wanted to. I've ordered some things off Amazon. I will let you all know about those items in another video later, once everything gets here and how I'm going to use it and all the things. So, and what else? That is all for now. If you have any questions or comments, please leave a comment, and I'm glad to answer anything about anything. Anything to my knowledge at this point. Maybe later on after surgery, I can answer further questions and such. And I do plan to vlog definitely what's taking place after surgery. For sure, do not worry about that. So yeah, I'm excited. I'm not scared. I'm not nervous as of yet. Who knows how I'm going to feel the day before, or even the hour before. So I cannot say right now. Right now, I'm just excited because it's finally here, because this has been going on literally since April. I had the consult and I got surgery date mid-June. So I'm just glad that everything worked out and that it's finally coming up. Yep, it's here. So please, 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 any questions, please leave a comment. I greatly appreciate it. And if you're someone who's already had this surgery or know more about it, please also leave a comment and let me know. Give me some tips, give me some items or products that, I should have after surgery. I'm most grateful for that as well. But again, I am K19. Thank you so much for coming along on this journey, and I'll catch you guys back up later. Thank you. Bye.